Glasses and fudging the prescription? Got a new pair of glasses recently. New lenses because mine were scratched up. Not because I had any trouble seeing. New frames because I thought I should. And it's very interesting. So I've been to quite a few glasses shops. But here in Asia, they often, will measure your prescription. You don't have to give it to them. And it sounds like that's actually smarter. Anyways, so when I got my prescription, the guy, maybe optician, optometrist, whoever it is who does it here, actually said, yours is about the same as it was before. A little bit different. Should we just keep your old prescription? And to those of you who don't wear glasses or may not have a lot of experience, I have obviously decades of experience, it may sound like something that's very strange in the vein of the doctor telling you, hey, so, for your medical condition, I have some medication for you. But I think you don't probably like the higher dosage. Should we go with a little bit lower dosage for you? It doesn't really work that way in the medical field, right? And I don't know if people consider optometrists different, but does it work that way in the optometrical world? So the thing with glasses is they're supposed to make you see better. But what does that mean, right? It's not like it gives me supervision, right? There's some people with vision that's better than 20/20. Are my glasses supposed to give me that? Is that what they shoot for? There's constraints with glasses. It's hard to make it perfect. And there's also limitations on this thing, the lens. You could go with higher index, goes all the way up to 1.8 even, or 1.9 in some places. But the thing is, that glass may not be so good, as in you actually don't see better. Huh? Is it higher better? Well, you would think so, except I guess other issues come into screen. See, glasses, optics, all those things, like making a perfect camera lens. Does it exist? Well, there's some lenses that are very heavy and very expensive and very good, but I don't know anybody would say they're perfect, right? If you have a wonderful lens, but it's this big and weighs like, 10 pounds, I don't know how often you'd be using that. The same with our glasses. And it's not the first time I've had an optometrist offer to use the same prescription as my glasses from the past, even though that's not what they measured. Think about it. They measured something, and they're offering you something different. What is their job? Is their job to measure and then give you exactly what they measured to give you the best vision? Why is it that some of them offer to give me my old prescription? What if my eyes have changed since then? Well, I guess they have, because there's a new measurement to see what's best for me. So first of all, there's a factor in what is acceptable vision. Many people don't have perfect vision. Many people could use glasses, but it's so low, like 100, who cares, right? Mine is 7 and an 800, so that's quite a bit. But the second thing is, if you're used to something, it's hard for you to adjust to a different prescription, especially if your vision is really bad, like mine. It takes a month or longer for me to adjust. I'll get headaches for a long time when I get new glasses. And right now, because I'm using the same one, I don't have headaches from my eyes having to reaccommodate. Taking this to the broader sense, in the medical field, oftentimes we're told to give patients this for this, right? It's sort of like numbers. The machine, which measures, or they're fiddling with number 1 better or number 2. Okay, number 2. They finally come up with the perfect prescription. And then they give it to you, right? They write it down. All they're supposed to do is copy it from one place to another, sign their name. Or is that what they're supposed to do? As a medical doctor, you see they have this issue, I'm supposed to give them this. That's done, right? Or is it? Because at the end of the day, who's the one dealing with the consequences? Who's the one having to go through everyday life? It's not like they're stupid and don't know I have an old pair of glasses. And if I don't like my new pair of glasses, maybe I'll just not wear it and say, I know my old lenses are scratched up, but hey, they're still better than a new one. And give them a bad review online, right? I mean, it's actually the same with doctors. Patients aren't so stupid oftentimes, and they know how to cut pills and take half of it or 3/4 or whatever, right? It's not like they ask the doctor for permission or tell the doctor I'm doing that. They just sort of do it or don't take it at all. After all, you're like, doesn't make me feel good. I better not take this. Right? What aspect of it is dealing with the person and working with the person, working with their afterlife, as in after seeing you, after going away from the clinic? Is it important? I would say it's the most important thing, right? I have to live with these for 18 hours of the day. Well, I'll probably sleep more than that, but at least 12 hours of a day, right? I want to feel good. I want to see well. And my definition of seeing well is not the same as their definition. They have an objective definition they measure about seeing well, but that may not be what I consider most important, right? I mean, you talk about seeing well. Those of us who wear glasses all the time, most of us, not most of us, some of us, at least me, a few others I know, our glasses are horribly dirty. We can't see well anyways. It could be the most perfect prescription ever. In real life, they're dirty. We don't clean them every day, or even every other day. They're filled with flecks of dandruff, smudges, this or that, but guess what? We see fine. See? Their definition of how good it has to be is probably not the same as mine. And the second thing is, when you say about what you can accept, right? Can we accept adjustments? Can we accept the fact that we have to learn to work with this for a month for my eyes to get used to it? And you're expecting me to just put up with the headaches? We also don't talk about that, right? In the hospital, I'm not saying I'm blameless, I'm often at fault as well. We ramp up the medications very quickly. We need to get people out. They may develop some side effects in the hospital, but they're so minimal compared to everything else you're experiencing, like the fact you get no sleep, get woken up at 4 a.m. to get your blood drawn, blah, 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 right? Don't get your food till hours later. So, patients don't. It doesn't seem to bother them as much. When you go through normal life, when to put up with this forever, I think a lot of things become magnified, more important. So I would say the optometrist wasn't fudging the numbers at all. The optometrist was being a good doctor. Seeing what I wanted, he gave me the choice. Do you want to keep your old prescription? Just off by a little bit, no biggie. Or you want this new one that theoretically gives you better vision. And he didn't have to say it, and there's obviously a translation issue here anyways. But we all know, I know, he knows, gonna take me some adjustment. Is it worth it to you? Because that's the thing, you need buy-in. Not worth it to the patient? Who cares if it's worth it to the doctor? Not gonna happen.